And now, away from that to health matters, now we're looking at the issue of COVID-19, and lots of things have been brought forward. We would know that even right now, the numbers that we're having are increasing as Nigeria's COVID-19 cases rose to 1,577 as total infections reach 128,674. We would know that this, according to what medical reports and medical research is saying, is a second variant, or rather a new variant of this COVID-19 pandemic that we are dealing with, and that's why more precautions have been called upon. That's wash your hands with soap and water, make use of alcohol hand-based sanitizers, and the federal government has tried to do their own part in making sure that they curb the spread of this virus. We know that even within the week on Monday, the federal government extended once again the ease of lockdown, even though recently it is considering a targeted lockdown in Lagos, Abuja, Kaduna, and some major cities across the country. Now, for now, it is still considering a targeted lockdown. That is from the Presidential Task Force on COVID-19. And of course, joining us on the program live via Zoom from Scotland, UK, to discuss this issue is Dr. Peter Imozi. He is the Research Fellow at the University of Aberdeen, Scotland, United Kingdom. Thank you very much for joining us on the show at this point in time. Dr. Peter, thank you for joining us on the show.
Thank you.
All right, we're looking at the issue of COVID-19. I know UK is, in fact, it's been on the news with lots of strain concerning this new variant of COVID-19. Now, let's look at the issue back here in Nigeria. I'm sure you've heard reports there, and lots of people have been complaining with the fact that Nigerian government is not doing enough to curb the spread of COVID-19, even with lots of measures that the government has put in place. How best do you think the Nigerian government can curb this new variant, and even explain to us why this new variant is more deadlier than before?
As regards to the new variant, it is all over in the world right now, specifically in the UK and in South Africa. It is referred to as the B117, and this particular variant, we are told that it came out from an individual who had a chronic disease. So what that implies is this virus, which is a COVID-19 disease, and the virus that causes COVID-19 disease is called the SARS-CoV-2. So it mutates over time, and based on this mutation, the virus was able to develop new ways to survive, and that is how the B117 came about. And so most of the tests that has been conducted, majority of the variant that we pick from those tests is the B117 variants. But there are different arguments to this, basically. This argument is the fact that people are saying that in the early days when this variant was picked, specifically in the UK, could it be that because people have kind of relaxed their guards, and that same period, it was when we were actually approaching the festive season. So the first time this case was reported in the UK was sometime in September, and the case kind of ramped up quickly as we wind down the year in 2020. So people are saying that could it be that because you had issues with festive period, that's why we had high number of cases with this particular infection rate? Because there's another argument that says that if, for instance, this variant was not detected and there was the old variant out there, the same issues would have emanated because people were not actually adhering to the non-pharmaceutical intervention. So the variant is not so deadly. It's just that there is high level of transmissibility, and that could be attributed to people's behavior. So festive period, you should expect people to congregate, celebrate, and what have you. Now down to Nigeria, what are the issues and why are we finding it difficult to address some of these issues as regards to COVID-19? The country is well populated, that is established. And secondly, when you look at the social amenities and the behavioral pattern of Nigerians and the availability of social amenities as well, it's not really easy for people to adhere to these rules. So I'll give you a case example. So in the UK, in Lagos, you have something called the BRT buses. And these buses, you could see that people are usually crowded in those buses. And when it comes to the marketplaces, we do open markets. When it comes to our economy, we're more like an informal economy. So how do you police these people who congregate in these areas to adhere to these rules and regulations? Now, on the issue of face mask, in Nigeria, for instance, we have a temperate region. How comfortable is it for people to have their face mask on for, or let's say, a period of 6, 7, or 8 hours in the public? So these are the issues here and there when governments are trying to set up regulations to ensure that people abide by those rules, or saying that you could get a 6-month jail term. When you then sentence these people to a jail term, basically, we know that the Nigerian prison service is overcrowded. How again do you intend to manage those areas? So it's really difficult for a country like Nigeria. And what we really need to do is, since people are not really coming down with this virus, the other hand we should be looking at is the research, like what exactly is going on with Nigerians. And that's where you need to do some key research. And if there is time, I could speak to those research as well.
Okay, looking at the issue of the vaccines, I know for African countries, I know that there's no African country that's been listed for the vaccine so far. How say people are still having fears of this vaccine, and especially with reports from medical research that this vaccine was majorly used, or rather the sample that they used was for the first variant and not for the second variant. So can you expatiate more on this vaccine?
So far, we have 3 vaccines that have made it to the very top, and the first is the Pfizer BioNTech vaccine. Then you have the Moderna. Then you have the Oxford AstraZeneca. Then you have the Johnson & Johnson that is currently at clinical trial phase 3. Now, when it comes to how effective this vaccine would be with the current strain, so when you look at the virus itself, you have what you call the spike protein. So when you look at that little cartoon you showed earlier on your screen, you have the little spike around the ball. Those spike is what the virus uses to gain access into the human host. So the majority of this vaccine are actually targeting the spike protein. So if you're targeting the spike protein, and based on that, you could easily tell if this current vaccine is going to be effective with any form of variant. And how do you do that? For instance, with the B117 variant we have, we've done a couple of genomic studies to see if there is changes in the sequence of that particular spike protein. So if there is no change within that spike protein wherein these initial vaccines are targeting, it means that the vaccine may likely still be very effective. And when it comes down to the doubt people have when it comes to this vaccine, I know I've heard so much about the mRNA vaccine in Nigeria and the possibility that the mRNA may likely change people's DNA. That's not actually correct. When you look at the mRNA, basically it's highly unstable. And I've also heard some top people in Nigeria saying that because there is a nanoparticle involved, then that has a capacity to change our genome. That again is false. So when you have the lipid nanoparticle, what that means is that you need that particular component of that particular vaccine to be able to warehouse the mRNA. And because the mRNA is unstable, that lipid particle is kind of protecting the mRNA to be able to use that medium to get into the host whereby you vaccinate this individual.
Thank you so much, Dr. Peter. Unfortunately, we've run out of time. Thank you so much for your input. But so far, so good. I know you were still saying that no matter what, this vaccine is still proven at least a bit effective for the people to use. So, but thank you for joining us on the show. We do hope that you join us subsequently on the program.
Thank you for having me.
All right, so it's looking at the COVID-19 regulation bill. As of course he mentioned earlier on, President Muhammadu Buhari has signed that regulation, and all those who are defaulting to make use of your face mask and COVID-19 protocols risk a 6-month jail. So please make use of all the COVID protocols. Thank you so much, Adekunle Yusuf and Victor Ayet, my beloved audience. Thank you for being a part of Editors Forum. Do join us same time next week, God's willing, for another edition of Editors Forum. Do stay safe.